Good afternoon, ladies and gentlemen of the House. I wanted to talk a little bit about the opioid crisis that we have here in the state of Iowa and in the United States. For a long time, we know that nicotine is the drug that has killed more people than any other drug and accounts for about 500,000 deaths a year in the United States. Alcohol has come in number 2 with about 100,000 deaths every year here in the United States. And for a long time, all other drugs accounted for about 20,000 deaths in the United States. And then we started having the opioid crisis here, which is now accounting for about 33,000 deaths a year, second to alcohol in the amount of harm that it is causing to United States people and their families. All addictions are disorders that affect the person who has the disorder and also many of the people around them and affect a good deal of productivity and are believed to be responsible to up to 40% of all hospitalizations. This last year, this General Assembly embarked on having an opioid committee that would look at these issues in the interim and to bring forth recommendations. The committee met twice, and I'm disappointed that the committee presented information about the minutes of the meetings and about some of the discussion that occurred in the meetings, but not as clear of recommendations of what we do about this crisis here in our state. It is my hope that we will address this issue directly and believe that it is a basis for a leadership bill, if no other bill, to affect the concerns and the impact that it has on Iowans. Our approach needs to be comprehensive, looking at prevention of this occurring and working with the medical community in reducing the amount of prescriptions of addictive substances in this regard. It also needs to be education of our public in making sure that people stay away from these substances. And it also needs to be treatment for people who have become addicted to them. With every disease, whether it is a dental carie or whether it is a mental health condition or whether it is a substance use disorder, there are always 2 Ds that we're looking at: the degree of distress and the degree of dysfunction that occurs with the disease. With opioid addiction, we have a high degree of distress and a high degree of dysfunction. We've made some headways with electronic prescribing and some things that help in that regard. But these are folks that, when they become addicted, are more likely to break the laws of our state and not conform to rules of our society that are beneficial to all of us. Therefore, I call on us as a legislature to address these issues in an aggressive manner before we go home at the end of this session. Thank you, Madam Speaker.